Now that you had your dental implants, whether it's one implant or multiple implants, should you add more maintenance to them? Should you use a special toothpaste? What should you do to maintain those implants and make sure that they will work for the long term? Here are the top 10 tips of how you maintain your dental implants. So I'm gonna break the top 10 into two categories. The first 5 is what you can do to maintain your implants at home, and the other 5 is what needs to be done at the dental office. So at home, number 1, there's no substitute for a toothbrush. Now that toothbrush can be electric or can be conventional handheld toothbrush. Either way, think about you have to do a brush twice a day, one in the morning and one at night. If you elect to go with electric toothbrush, make sure that it is a new version and that has an indicator light. It will show you that you are brushing too hard or too little. And as far as the toothpaste, it really doesn't matter. My preference is to more organic style of toothpaste, and I will leave the name in the description. 2 is floss. You still have to floss around your implants. I prefer to use a non-wax floss, and the one trick with the floss is that it needs to be done just a little differently around the implants than around natural teeth, because the implant emergence profile is usually round and the natural teeth are oval or different shape. So when you floss around regular teeth, you go up and down, but around the implant, you have to hug the implant crown. So you might have to go with a little bit angled in so you can ensure that you clean all the food debris. 3 is the best friend is Water-Pik. It's kind of a must for people who have dental implants, and it helps flush all the food debris that you could not take it out with the brush and the floss. They are different kind. Some of them are portable, smaller, and more impactable, so we prefer those. Number 4 is a mouth rinse. There's a different type of mouth rinse. I prefer to have the non-alcoholic type. And in some instances, we might prescribe a medication mouth rinse, but you don't want to use that, which is Peridex, for a long period of time because it can stain your teeth. Number 5 are special tools specifically designed for implant maintenance. These are, for example, the Tepe proxy brushes that can go in between. In case you have gaps between the teeth, this will be a very good device that helps clean your implants. The other top 5 is what you have to do for your implant maintenance at the dental office. And we'll start with the number 1, and that is regular cleaning. You still have to go to the dentist for conventional cleaning twice a year. Just like your natural teeth, implants require maintenance and cleaning. There is no substitute for that. Having an implant does not take away the need to go and have conventional cleaning. I hope I can emphasize this. Number 2, you need to have x-rays done on a regular basis. This way we can evaluate the bone volume and make sure you're not losing bone, and if there is, you're losing bone, and we can do something to correct it. And that can only be done through x-rays. So x-rays, the dentist can decide if you need those x-rays once a year, once every other year, and if those x-rays are the small x-ray or the CT scan style images. Number 3, you have to check the bite. Remember, your implants do not move, your natural teeth will. So with time, your implant can take on more biting forces just because the other teeth shift around and you start biting too hard on your implant. So if you start feeling that the bite is off a little bit, it's a good time to go and check with your dentist and have this thing corrected. Number 4, things that you have to keep checking is for mobility. Remember, any mobility around an implant is not good. So that mobility can come from the crown or it can come from the implant itself getting loose. Either way, if you start feeling that there is anything loose with your implant prosthesis, go ahead and have it checked right away. And it's important to have it checked right away because if the crown is loose and it's not completely out, it can have some bacterial leakage that's going on the inside, can cause you an infection, or you can destroy the internal components of the implants, and that's not good for the long run. Number 5, and the last things that I want you to check for is if you start to develop space between the implants and the natural teeth. With time, the teeth might shift and migrate and can go forward, but your implants will not. And what that will cause is a little gap between the crown of your implants and the natural teeth. And that little gap can accumulate food debris. And that food debris with time can cause gum disease, bone loss around the implants, and can associate with actually cavity around the natural teeth. So it's a very common things that we're finding in the long term between implants and natural teeth. That is the gap that is forming. The sooner that you can feel that gap, it's probably a good idea to go and see your dentist, and we can do some things to fix it, add some more contact, and this way we can increase the life of your implants. So make sure to follow those 10 tips to ensure the longevity of your dental implants. Of course, if you have any questions, you can always contact us and visit our website, and hope this video can help you make a better decision. Thank you. If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.